What's good, y'all? C.Shreve back here once again with an episode of Who Needs a Classroom? The answer to that question is everyone in the world right now. Somehow the current events of the world have fallen as such that my wheelhouse of academic expertise, public health, is everywhere on the news. So just to remind you, a rapper is not just telling you about what you should do with your hand washing. This was the job I left. This was my textbook from last semester in the fall. Epidemiology of chronic disease. We also talked about infectious disease, which is what we're talking about now. I used to teach for over a decade at the university level, basic statistics for the health sciences, also known as biostatistics. That will come into play today. Also, these have been many times taught over by me. Community, public health, health behavior theory, get involved in all this. So, not a rapper just talking at you trying to be relevant. Let's get that out of the way. That's kind of my background, again, taught at a school of public health for like the last decade, 12 years, something like that. So I feel like my perspective is necessary to bring to the table here. So why? Partly because the misinformation that's out there. I mean, we start to be like oversimplistic and start to think, oh, we just got to wash our hands. Oh, we just got to cough into our elbow, things like that. And then when an idea like social distancing comes along, people think overly simplistically with that one as well. So need to get into these a little bit. So hand washing is an easy place to kind of jump into for an example of something that has more complexity than you might imagine. When we look at the statistics from hand washing, we see instantly inequalities or disparities or imbalances in terms of what we'd expect to see. We see men being much less likely to follow through with hand washing. I've seen this anecdotally. Asked a friend of mine, yo, why didn't you wash your hands? And he was like, well, I didn't pee on my hand. And I was like, well, it's not the reason you wash your hands isn't because you have fecal matter or you peed on your hands or something like that. Yeah, that's part of it. Yes, we are trained and know that we wash our hands before we eat. We wash our hands after we go to the bathroom, da-da-da. You also wash your hands for the 500 people that touched that doorknob today. Or you wash your hands because you haven't washed your hands the last couple of hours and you're exposing yourself to potential risk when you touch your face or when you dap somebody else up or when you go from being out in the working world and some airports and come home and greet your family. Or in the case of my family, my spouse going out in the world and seeing patients and then potentially coming back with this potentially infective disease in our home. So things get real when you start to look at it like that. So the idea of imbalance, the idea of disparity, of men and women having a different pattern regarding hand washing, it relates to health practices in general. But that's a great example of disparity, of things happening in an unequal fashion. What's the goal of public health? To learn from and remove disparities. That's our key overarching goal. So when you hear something from the CDC, remember that it's driven by that overarching goal of reducing disparities, of kind of doing what America's supposed to do, our pledge of, fair and equal and whatnot. The healthcare system kind of has to be that, because if you're in an emergency room situation, if you are in a practitioner situation, you have to respond to the patient in front of you, regardless of who they are. So health levels the playing field somewhat in the way that we view humans, I think. So that's why I was drawn to public health. All right, so get back on track. Let's see. Disparities. So what do we see in this disease, in the coronavirus and the COVID-19? What do we see? We see a disparity by age, right? We see elderly Americans and humans being overly impacted. Their immune systems potentially being more vulnerable. Maybe they're less vulnerable to the normal flu because they've had enough flu seasons to have kind of active antibodies. But with this one, they don't have it. They were vulnerable. We're seeing higher mortality rates, right? So there's a disparity. Age being a disparity across different age demographics, different patterns. We also had mention of geographic disparities, of West Virginia being the laggard, as we would say, being the final one to have a case. They're already socially distanced if you think about it. Not as many huge major airport intersections as in New York or as places in California or the Northwest, kind of Seattle being a major hub, and then potentially, things reflect kind of going outward from there. So this gets into epidemiology, gets into patterns. So let's talk about the most simple pattern that kind of is out here. So the bell curve, most of you have probably heard of that when you were in high school and maybe taking an SAT or maybe being graded against your peers in a presidential fitness test if you're like an 80s baby like me. So the bell curve, right? This patterned kind of traditional curve. If we break it down, we would see 2/3 of the population falls kind of within this standard set of deviations. We don't need to get into all that, but that's how our curves normally work, is about that. We see there's funny ones like the durability of light bulbs to all the way to the brightness of galaxies, kind of for here to there. We see it for different disease patterns. We see it for things like height. Used to be weight. Weight, we saw go from this to, in the last 30 to 40 years, becoming a flattened curve. We've seen this other curve. Let's do it in blue just so we have a different one. This flattened curve. And so what does that look like? Something like that. Of course, my curve drawing is less than optimal these days. I'm doing other things, but something like that. Okay, so the curve got flattened. What does that mean? In America with obesity, that meant that we have higher weight percentages. What is this? This is prevalence, maybe a gradient like weight or a gradient like prevalence of disease, or over time, as time progresses. So in the case of a virus, in the case of COVID-19, what we're talking about is time, as time moves forward. And we're talking about, in this case, prevalence, cases, the number of sick and infected people, or the mortality, or the cost, or something like that. So let's say there's various variables there. But we could say, let's say, cases. As they rise, and they tend to follow a pattern, we tend to see bell curves out here. As that happens, there are thresholds here. There are economic thresholds. There are patient overload thresholds for hospitals, for healthcare systems, at small micro levels and at macro levels as well. As those different thresholds are hit, or begin to fracture the healthcare system, or begin to mean that your grandma doesn't have the optimal health outcome or chance for that because she's in line, because there's 4 providers there or 6 providers in that county, and then what happens when those providers get sick. So the idea of delaying the curve, of flattening the curve, is to give you more time. Because some of these first responders, where are we at? Somewhere in here, we hit 4,000 cases, so we're on our rise, right? And maybe it's not as steep, maybe it's a little more of an incline, because curves vary. They're not always standard. So as it rises, we're trying to flatten that rise, because as this happens, there's more room for our healthcare system to respond. There's more time for the nurses that get sick here to maybe get better and be able to come back and help here. Whereas if everything happens in a condensed region, there's buckle points that will happen in various healthcare systems. So this is what we're trying to do. When we say social distance, we are saying to minimize your contacts, your vectors for disease. Because as we've said, you could be a carrier, as you've seen probably watching the news while you're in your house, self-isolating, hopefully. You see that the more people we come into contact with, the more potential outcomes for negative there might be. So, if your kid goes to school, goes to preschool, interacts with 45 people who all interact with at least, another 10, 20, 30, 40 people themselves, next thing you know, that kid goes to grandma, they aren't even sick, but they bring the sickness there. So social distancing, is it even possible in some settings, in urban environments, where people rely on public transportation? Is it possible to avoid overcrowding in subway cars? Or we saw the backup at the airport. We hope that was avoidable, but literally cramming 700 people into a small area in order to filter them by disease risk. They automatically put everybody's disease risk pretty much the same by crowding them into that area. So it's really testing the foundations of what we're able to handle as a society. Restaurants banning people from gathering inside them. We're going to see things like this continued. So other ideas here, what did I have? Another public health 101. We have an aging population. So when you say, it's just the older folks, it's just an older population that happened in Italy. Well, America has an aging baby boomer population, which if you know your curves at all, we have this overcrowding of World War II era babies, who are my parents, who are my parents on the younger side, so closer to 65, but beginning to be at the elderly age at risk for something like this. Some of the older ones of that generation kind of cohort might be closer to 75 or 80, so very at risk. So we have an aging population, luckily one that's not frail. Our curve for weight is flattened already, so we hopefully have some hardiness or some vigor, but our cardiovascular disease risk, some of our smoking history plays into this potentially. So this gets complicated by the current scenario that America has. Other ideas here, I think I've hit most of them. Avoiding, and let's relate this to a couple concepts. Avoiding panic obviously is a helpful thing. That gets into public messaging, what you're saying from the top down. And that gets into, again, the disparities of America's history, and the dynamics between different communities, the dynamics between the haves and the have-nots, and the lack of dynamics sometimes. And so when our president comes out and at some point says, and already has said, and said this morning, and continues to call this a Chinese virus, that's a loaded set of issues when you equate an entire issue, an entire potentially world halting and stopping scenario, and put that there. When you other something and say, oh, it's that problem. When you do that, when you say other, when you create a punching bag, a shadow, when you look at it like that, or when you also further normalize it being done at the highest level, it is further and continuously going to be responsible for the backlash you see in terms of fired up bigotry. It is the dog whistle. It is the, oh, if it wasn't for them, that is such a documented and historical part of who we are as a community of being Americans, that we should sniff it out immediately. We spot it. We can see that. With full disdain, push that away and negatively respond to that. There's no way we can allow our American brothers and sisters of any nationality, of any further previous background or creed, religion, you name it, potential way of viewing the world, potential way of interacting with the world, presentation and or otherwise. We are America. We are the land of the free, supposed to be the melting pot, the place where somehow the new world gets it right. It doesn't have the dogma of the old class systems, right? No, we've perpetuated these ridiculous things long enough for us to have to be in close quarters with one another, with children, with grandparents, being forced to say we're going to stay self-quarantined, isolated. Maybe this is a time for reckoning and for realization and for coming together. We're being forced to, albeit separately, to come to terms with our own shortcomings, demons, whatever you want to call them. But when we see misinformation, when we see lack of coherent thought going on out there, we have to respond to it. We have to reply to it sometimes, because the loudest voices in the room, although they are not correct, they will be heard. The overprojection helps them to have platform. And so if someone in the classroom or someone on the stage, someone in the greater sphere of being isn't able to speak up and have the counterpoint be heard, then what do we have? We have no discourse. We have a dominated discussion of who's the best at being heard. I think we should all realize that doesn't have the best outcomes. That doesn't equal everyone's voice having even a chance of being reflected in that final outcome. So as I ramble off on my tangent, which if I was in a classroom, I would totally do, so maybe we got a hint of what a classroom is supposed to be like here. Again, flatten the curve is a concept that should not be super difficult for you to grasp if you understand how a graph works of time versus cases, cost, something like that. We're trying to slow the impact, which is why there's drastic steps been taken to have schools shut down, to have workplaces shut down. Where would I respond? We need to go to help to solve the issue of those who it's not feasible to stop working. It's not feasible for bills to stop trying to work. Understood fully, my man, my woman, anybody out there with that issue. I have those same issues. This is where government policy, where public, i.e. potentially the state, gets involved and says, moratorium on mortgages for the time being. You know what? We've bailed you out, Wall Street. You can put a hold on cashing in on the American worker. $1,000 doesn't do anything but pay your rent for a month for most people at best. So let's get back to the drawing board and figure out if America has to halt for 3 months, let's figure out what those bootstraps type policies are supposed to be so that average Joe can have a chance out here. Because although I have the absolute privilege to have been able to have a job, have an education, have a life condition that allowed me to have work, not everyone has that. And I was fortunate enough to decide to try to switch gears, which let me tell you is not really good for a rapper right now. I think I lost 20 to 25 shows. I lost a tour. I lost every festival appearance it was going to be, because all festivals, all shows are inherently bigger than 100 people, unless you're an underground rapper like me. And I almost thought I could fly them under the radar because, half time it's 75 or 33 or whatever. But no, I can't perform. I can't do. So the paradigm shifts in terms of how I was going to be able to potentially make money. It goes to more, putting content online in a different way. So this is real, obviously. I like my man Lupe Lupe Fiasco, his idea of Taipei, be safe, Taipei, take your punk ass in the house. There's no need to be, okay, let's finish it with this. My youngsters, my people who probably took these classes at App or wherever, probably at App because that's where most of my career was at. Do not, and what are you doing going drinking on St. Patrick's Day? Really? Are you going to also try to compensate by that by taking grandma flowers? Because you're a moron if you do that, right? You interacted with 600 people potentially, and you take grandma some flowers, all those vectors to her. Better not, okay? Understand the concepts we have here. Minimize crowding situations if possible. If you have to keep working, but do so in a fashion that somehow maximizes your health. Make some different micro decisions that help that to happen. But do not be out there just flexing. I'm gonna grab me some plane tickets. Okay, 4-hour flight to wherever, trapped in a plane with other people who have to be out there when you shouldn't be out there, and then you're gonna get coughed on and breathe all that air. No, don't put yourself at risk. We're not playing here. Maybe this is a hunker down 2 or 3 weeks and we get through it and we're like, what were we thinking? We overdid it. Okay, good. But if we don't do that, it's a 3 to 6 month period, 8-month period of literally millions of people dying and our healthcare system being overwhelmed by the gravity of what's happening in a way that breaks economic systems and that is the tidal wave that will collapse entire markets and cause scaring and panic. And that is the sense of urgency I want to leave you with. And that doesn't mean go buy a bunch of toilet paper. And that doesn't mean go buy all the milk and freeze it or all the guns and ammo. It means look out for one another by being a compassionate human who realizes how to minimize the spread here. Stay home if possible. Minimize your social interactions, so that we can not have this thing pass from person to person to person, a carrier and a carrier who doesn't show symptoms, and then who goes to symptomatic, We don't need all that. Listen to what's being asked of you, if possible, and stay calm, all right? You don't have to go nuts out here because people, when they see there's no toilet paper, end up thinking, oh shit, right? So, bars. So bottom line, get out there when possible. If you can get outside, and go for a walk, you're not around people right there. You're going to get cabin fever, so you got to get out of the house somehow sometimes. Some places that's not even being allowed, so that becomes tricky. How do you move your body? How do you get your isolation prison workout on in the house? Get a medicine ball, get some dumbbells, use your body, use some squats. You know what to do. Come on. Maybe I'll do a health promotion episode about how to do your, at-home workout. Although I don't have to. You know how many quarantine workouts there are if you hashtag quarantine workouts? Come on, utilize your social media. Utilize it however you need to. I saw my friend Marissa Blake was doing 1 p.m. readings. So if you have kids home and you need some help so you can do your emails for an hour at 1 p.m., check out what she's got going on. She'll read the Lorax to your kids right there. Come on, Nelly. We need more of that. We need trades. We need community in America, which is tricky when we got to isolate, right? But you got to find a way, okay? This is not going to be easy, but America has been in worse situations than this. We don't need to repeat the falls of previous folks trying to walk, right? All right. Much love, peace, blessings to all of you. Treat your fellow humans with respect. Be a good human. What does that mean? It means seeing yourself in their shoes and their eyes and realizing they have some of the same trials and tribulations you have and ones you've never even thought about. So don't worry so much about the terms and like the technology related to how we collect statistics and how, but learn that the CDC has your best interest in mind. They want to mitigate this for all humans in America, really the world too, but CDC is America focused, so they got your best interest. They got your back. So I'll check back in on this. It's rapidly developing, obviously, but respect and love to all of y'all. Take care of your people. Look out for the world and whatnot.